Have you ever stopped to wonder how we make sure healthcare actually makes us healthier? It's this huge, complicated system, right? But today, we're going to break it all down. Get ready for the pretty fascinating and honestly super unexpected origin story of healthcare quality. It's the big question, isn't it? I mean, we put so much trust in our healthcare system, but we all kind of know it's not perfect. So why? Why does the quality of care seem to vary so much? Well, to get to the answer, first we have to understand what can actually go wrong. And that's exactly what a huge landmark report from the Institute of Medicine did back in 2001. It took a really hard look at the whole system and basically boiled the entire quality problem down to three major issues that, we're still wrestling with today. Okay, first up, there's overuse. This is basically when you get care that you don't actually need. The classic example is getting antibiotics for a cold, which, well, it's a virus. The pills don't do anything to help you, and it can even lead to bigger problems like antibiotic resistance. It's care that costs money but adds zero benefit. Then, on the complete flip side, you have underuse. This is what happens when you don't get the care that you absolutely do need. Just imagine a patient who really should get a critical diagnostic test, but for whatever reason, it just doesn't happen. That's a huge missed opportunity to get better, and it's a major quality gap.
And finally, there's misuse. This is when the right service is given, but it's just done wrong. These are those preventable errors, the avoidable complications we all hear about, like the truly horrifying example of a surgeon operating on the wrong part of someone's body. So you've got these three big problems, three dragons, if you will, that quality management is designed to slay.
So here's our game plan. We're going to start with the quest for better healthcare. Then we'll break down the core quality cycle. After that, we dive into its surprising industrial blueprint, see how healthcare is playing catch-up, and finally, look at the external pressures that are forcing things to change. Okay, so how on earth do we begin to fix these massive problems? It all starts with a simple but really powerful continuous loop, a way of thinking that's all about constant improvement. At the very heart of the solution is this core quality cycle. It's not a one-and-done fix, it's a constant process. You measure your performance, you assess whether you're meeting your goals, and if you're not, you work to improve, and then you start the whole cycle all over again. You can think of it just like managing your own personal finances. You measure by tracking what you spend, you assess by checking your bank account to see if you're hitting your savings goals. And if you're in the red, you improve by cutting costs or, I don't know, maybe getting a side hustle. It's the exact same logic, just applied to patient care. All right, now this is where the story takes a really interesting twist. You might think this whole quality cycle thing was developed in a pristine medical lab by a bunch of brilliant doctors. You would be wrong. The blueprint for modern healthcare quality was actually forged on the factory floor. So let's meet a few of the pioneers here. It all starts way back in the 1920s with a guy named Walter Schuhart. Then, after World War II, W. Edwards Deming and Joseph Juran took these ideas over to Japan and completely revolutionized their manufacturing. They were joined by Kaoru Ishikawa, who brought frontline workers into the mix. And get this, none of these guys were doctors. They were engineers and statisticians. Schuhart's big idea was all about using statistics to understand variation. Think about it. In a factory, you want every single product to be identical. Schuhart figured out that by measuring and controlling all the little undesirable variations in the process, you could slash waste and dramatically improve quality. So you could say Schuhart taught us to measure. Then Deming came along and built on that. He saw that it wasn't just about the stats. It was about understanding the entire system, the processes, the tools, and especially the people. His philosophy is a huge part of why Japanese products went from being low quality to absolute world-class leaders. Deming taught us that we have to perfect the system. And then there was Juran. He was the one who really connected the science of quality to management and, to the money. His quality trilogy, planning, control, and improvement, gave managers a clear playbook. Juran, in short, taught us how to manage for quality. So you've got these incredible, proven ideas that are totally revolutionizing manufacturing around the world. You'd think healthcare would jump right on board, but the reality is, medicine was incredibly slow to adopt any of this stuff. The question is, why? Well, the reason was a deep, deep philosophical divide. See, healthcare traditionally ran on a craft model. The thinking was basically this: if you train good doctors and nurses and give them a license, you'll get good quality. And if something went wrong, you find the person responsible and you discipline them. The industrial model was completely different. It assumed that even really good people will make mistakes if they're working in a bad system. The focus isn't on who made the error, but why the system allowed that error to happen in the first place. That is a radical shift from blaming people to fixing processes. So what finally forced healthcare's hand? One word: money. By the 1980s, healthcare costs were just skyrocketing. The pressure from governments and insurance companies, the ones footing the bill, it became so intense that the industry had no choice but to start looking for new solutions. And they found them in those decades-old lessons from the factory floor. And that brings us to the modern era, where quality management is no longer just a good idea, it's often mandatory, thanks to some really powerful external forces. Today, there are basically three main groups pushing for quality. You have government regulations, you have private accreditation groups that set all the standards, and most powerfully, you have the large purchasers, the ones who are actually paying for all this care. And when we talk about large purchasers, there is no one bigger than the government. Just to give you a sense of scale, back in 2010, the Centers for Medicare and Medicaid Services, or CMS, spent over $500 billion on patient care. With that kind of money comes immense power to set the rules. The main tool they use to set those rules is something called the conditions of participation. You can really just think of it as a contract. It spells out all the quality and safety rules that a hospital or a clinic has to follow to even be eligible for payment from programs like Medicare. And that really is the bottom line. It's a very simple and very powerful lever. If a healthcare organization wants to get paid for treating the millions of patients covered by government insurance, it has to play by the quality rules. No compliance, no cash. It's that simple. So we've seen that the tools and the systems to improve healthcare quality were actually invented decades ago in a totally different industry. We know that external pressures are now forcing the system to change. So this leaves us with a final, really crucial question. The blueprint is there. So what will it truly take to build a high-quality healthcare system for everyone, everywhere?